Welcome to my YouTube channel. Today we're going to talk about cancer of the cervix. The cervix is the terminal end of the womb, the part that is able to dilate to allow childbirth and remain closed in order to keep the baby up as the baby develops during pregnancy. So that is the area we're discussing today. So what are some of the signs of cancer of the cervix? First of all, one might notice a discharge that is maybe foul-smelling or a constant discharge that is not normal discharge. Another thing can be postcoital bleeding. What is postcoital bleeding? Is having bleeding after having sex or painful intercourse. Another sign of cancer of the cervix that has been noted among patients is lower abdominal discomfort or backache. These are some of the signs that are noted. So what are the risk factors for cancer of the cervix? What puts you at risk of getting cancer of the cervix? One, early sexual debut. If you started having your sexual activity early in life, the younger you are, and the higher the chance of you getting cancer of the cervix. Another risk factor that is there is low social economic standards. That has been noted to one of the risk factor. Multiple sexual partners is also a risk factor because it means you have a higher chance of being exposed to the human papilloma virus. The human papilloma virus, many strains of it have been developed, have been noted, but about 15 have been noted to be causing or contributing to the development of the cancer of the cervix. So how do we screen for cancer of the cervix? Well, many would ask, what if I have the symptoms? What should I do? Very important for you to visit your healthcare professional so that you can do a vaginal examination. When we examine the vagina, what are we looking for? We can be able to do two things. One, you can do a via biopsy, you can do a pap smear, or we can even be able to take a biopsy of any of the lesions that we are able to see. Remember, in oncology, tissue is the issue. We cannot make diagnosis of cancer without having seen the cancer cells under the microscope. That is with the help of the pathologist. So please, kindly, go for cancer screening. We encourage women to have a good relationship with their gynecologist and health workers. Get a speculum examination done, get a via vela done, get a pap smear done, and based on the results you find, we will advise on what should be the next course of action. Do not wait until you have symptoms. Get screened today. Make sure you know whether you have it or not. So what should we encourage? The Ministry of Health in Kenya, prevention is better than cure. So there is a vaccine against the human papilloma virus that has been rolled out in the country. What is its role? It reduces the chances of your daughter or your son getting cancers that are related to the human papilloma virus. The uptake has not been as good as we would have wanted it as healthcare professionals. So what do we encourage? Parents, kindly let your children get this vaccine. Help them get prevention. Prevent them from having cancer that is very devastating and difficult to treat. Kindly let them get vaccinated. And for us, let's all get screened as women. Let's know, do we have any lesions? Sometimes the lesions are at the point where it's called pre-cancerous. They're not yet cancer. They're easy to treat, and once treated, the risk of developing cancer is eliminated. Early detection saves lives. Kindly go get screened. What if you discover to have cancer? What should you expect? There are many treatment modalities based on stage. For very early disease, surgery is an option, surgical excision. If the disease has progressed maybe 2B and above, then we have chemoradiation. Chemo is a drug that is put through your vein. What is its role? To sensitize your cells to get radiation, to be killed by the radiation itself. And what else can be done? We can also give chemotherapy based on the stage, and its role can either be curative, radiosensitizing, or also palliative in nature. So kindly get screened today. Let us fight cervical cancer. Thank you. See you in the next update.